Tyler thought he was smart. He had health insurance, made a budget, and invested every month. But one day, he collapsed during his morning workouts and had to be rushed to the ER. His surgery went perfectly, and everything was back to normal in a week. Then, he got a bill for $8,000, 100 times more than he'd pay in Europe. This wasn't an error, it's just how the system works in the US. But why? I passed the CFP exam at 16 and have helped millions improve their finances over the last 8 years. Here's exactly why the system works this way and what you can do about it. First, let's understand the numbers. Without insurance, the average ER visit runs between $1,500 and $3,000 before a single procedure is done. That's just for walking in and being seen. And if you get admitted overnight, it can cost more than $15,000 per night. Health insurance is essential to reduce the cost, but it won't save you from these 3 traps. Facility fees. Hospitals charge a separate fee just for using the building on top of whatever your doctor charges. It can be hundreds or maybe even thousands of dollars and shows up as a completely separate line item on your bill. Deductible plus coinsurance. Most people know they have a deductible, but that's just the start. Say your deductible is $2,000 and your coinsurance is 20% after that. If you have one serious medical event, you could end up paying up to $8,500 even with insurance. Ambulance rides are often out of network, so a single ride can cost you $500 even with insurance, and it's at a time when you don't have a choice. These billing traps are expensive, but they're only part of the story, because the pricing system behind all of this is the root of the problem. By the way, if this video is helping you, please like and subscribe. It helps more people find practical money management tips like these. Every hospital maintains a charge master, which is their internal price list for every single service they offer. These prices are wildly inflated, often 10 to 20 times the actual cost of care. Insurance companies negotiate big discounts off that list, but if you're uninsured or out of network, you end up paying something much closer to the full chargemaster rate. So your cost has a lot more to do with who's paying than the care itself. And because there are thousands of different unique health insurance plans, around 25% of what you pay goes toward administrative tasks. Hospitals hire dedicated teams to navigate this complex system, and that cost gets passed on to you. Here's the worst part. Hospitals across the country have been merging and buying up physician practices for decades. When one hospital system has a near monopoly on specialized care in your region, there's no pressure to compete on price. They can charge whatever they want, so they usually do, and everyday Americans end up paying exorbitant prices. Price transparency rules went into effect in 2021, requiring hospitals to post their prices publicly. But many people don't know this info is available, and many hospitals publish the data in a way that's too technical for patients to understand. Now you know their game, but to beat them, you need to take action. Watch this video to find out what you can do before, during, and after your visit to save thousands of dollars.